Welcome to timesofIndia.com Digital Conclave on National Doctors Day, a tribute to the torchbearers of our health. I am Dr. Ananya Avasthi, your moderator for this session. As a quick introduction, I'm a public health practitioner with a master's in global health from Harvard University. My background is in policy consulting, and I currently lead an organization called Anuvad Solutions that works on translating science to inform policy action on health and nutrition. Starting with the context to this conclave. Medicines cure diseases, but doctors cure patients. These words by renowned psychologist Carl Jung emphasize the invaluable contribution of doctors to humanity at large. Doctors are indeed the pillars of a country's healthcare system, often sacrificing their own well-being in service to others. In India, we observe National Doctors Day on the 1st of July, commemorating the birth anniversary of the visionary doctor, Dr. B.C. Roy. Today, on the occasion of National Doctors Day, timesofIndia.com is hosting a digital conclave, bringing together doctors from diverse disciplines and policymakers to recognize and celebrate our health warriors and discuss the most pressing challenges they face in dispensation of their duties. So let us begin this exploration with this topic for the webinar called Physician Burnout. Physician burnout has emerged as a significant problem affecting healthcare professionals worldwide. As medical practitioners, physicians play a pivotal role in providing high-quality patient care, yet they often face overwhelming stress, emotional exhaustion, and loss of enthusiasm for their work. Research indicates alarmingly high rates of burnout symptoms, almost exceeding 50%. The consequences of burnout are far-reaching, impacting not only the well-being of healthcare professionals, but also patient outcomes in the overall functioning of healthcare systems. We'll talk about reasons and contributing factors in a bit, but only to say that India has an additional challenge, which is to say that it has a low healthcare worker to population ratio, which is well below the WHO guideline. This imbalance puts additional and tremendous pressure on physicians who contribute day and night to providing quality care. In this session, which is titled Physician Burnout, Ensuring Work-Life Balance and a Sound Mental Health, our aim is to shed light on this critical area of concern with the guidance of our distinguished panel of medical experts. So with that, let me get started with panelist introductions. We have with us Dr. Randeep Guleria, who is a highly accomplished and respected medical professional in India. He holds an MD in medicine and a DM in pulmonary and critical care medicine, serves as the chairman of the Institute of Internal Medicine and Respiratory and Sleep Medicine, and the director of medical education at Medanta. And as we all know, he's the former director of the All India Institute of Medical Sciences, AIIMS. A Padma Shri awardee, Dr. Guleria has received numerous awards of national repute, including Dr. B.C. Roy Award for Eminent Medical Person, 22nd Lal Bahadur Shastri National Award for Excellence, Healthcare Excellence Award for Outstanding Contributions in COVID Care, Himachal Gaurav Puraskar, LIC Zee TV, Swasth Bharat Saman, amongst others. Then we have with us Professor and Dr. Srinath Reddy, who's the founder and past president of the Public Health Foundation of India, where he is now also the honorary distinguished professor. He formerly led the Department of Cardiology at AIIMS, New Delhi. He was appointed as the first Bernard Lawn visiting professor of cardiovascular health at the Harvard School of Public Health, and presently serves as the adjunct professor of epidemiology at Harvard. He holds advisory positions in several national and international bodies, has over 570 scientific publications, and also has published a book called Make Health in India, Reaching a Billion Plus. His contributions have been recognized and honors with like the WHO DG's Award for Outstanding Global Leadership in Tobacco Control, Padma Bhushan, Queen Elizabeth Medal, and many other such fellowships and honors in his name. Then we have with us Dr. Sunil Khetarpal, who is the director of the Association of Healthcare Providers, dedicated to educating and advocating for the well-being of the common people. With 34 years of experience in the healthcare industry, Dr. Khetarpal is a renowned expert in hospital administration, operations, strategy, innovation, quality, and accreditation. He has been associated with NABH since its inception and has been a recipient of numerous awards and honors for his contributions in the field of healthcare. Then we have with us Dr. Kapil Gupta, who is a highly respected consultant in the Department of Emergency Medicine at the Manipal Hospital in Dwarka. He serves as a distinguished faculty member for the Emergency Medicine Postgraduate Program accredited by DNB NBMs. Dr. Gupta also holds the prestigious position of Immediate President and Core Committee member of the Association of Emergency Physicians of India, AEPI. Additionally, he is a valued member of the Royal College of Emergency Medicine, actively contributing to academic activities nationwide. And finally, we will soon have with us Dr. Pratima Murthy, who is the professor and head of Department of Psychiatry at NIMHANS. So with that, let's get started. My first question to you, Professor Reddy. Is physician burnout only spoken in terms of anecdotal evidence, or the problem is really real? So tell the viewers, how real is physician burnout, and especially from a public health perspective, how prevalent is this problem in India and of course worldwide too?
Physician burnout is a fairly widely reported problem, internationally as well as in India. While it has not been well quantified because of in-depth studies across the country, in India there have been several studies in different parts, and there has been a study in 2020 which put together data from 15 such studies and indicated that this is fairly widely prevalent. If we are looking at the three major manifestations of physician burnout, which is emotional exhaustion, depersonalization, and diminished personal accomplishment. It was reported, based on about 15 studies collated together, that 24% was the number reported for emotional exhaustion, 27% for depersonalization, and 23% for diminished personal accomplishment. A sense that one has failed to do one's duty and one is incapable of doing it. Depersonalization is essentially disconnecting from one's professional role and not identifying with oneself as a professional. And emotional exhaustion, of course, is something that saps your energy and prevents your performance. But remember, this is a study that was done and published in 2020 from data that was gathered much earlier. What happened in COVID exacerbated the problem, because the huge load that physicians had to really undertake in terms of COVID-related care, and often in terms of very adverse circumstances of high patient volume loads with relative lack of equipment and resources. That certainly led to a greater degree of physician burnout. And it also happened to coincide with not only an increased workload, but also personal illness or illness among family members. So I would say that compared to the quarter that experienced it before COVID, the numbers would have been higher after COVID. But then we now need to document some of the studies to see what the after effects are currently.
Right. And we'll come to that question on how COVID itself has been a big contributing factor. My next question to you, Dr. Guleria, talking of the Indian context, of course, you've led AIIMS, which is the most prestigious medical institute in the country. And anyone who's seen AIIMS has seen lines of patients being attended by a single doctor, which is, of course, the reality of the context that we live in. So how do you respond to the problem of physician burnout, especially in an Indian setting and especially in a government hospital setup?
It's a problem which is quite widespread in India itself, even globally, and COVID, of course, aggravated it. But I think it's important for us to understand that even at the All Institute of Medical Sciences, we see a lot of burnout and suicidal tendencies among residents and among the junior doctors, because with time, the workload has increased and the stress in terms of demands from residents has become much more. The patient load has become more, the investigations have become more, and medicine has moved more from what was traditionally a clinical medicine to more and more investigative medicine. And with a lot of technology coming in, the demands of feeding the data in, entering a lot of data has also really caused a lot of stress. There's also a stress because of the patient-doctor relationship, especially in emergency medicine or in the emergency or in the ICUs. All of this has actually caused more strain on the younger doctors, and many of them therefore find it difficult to cope up. There are doctors who actually contemplate leaving the profession or taking something which is much lighter in terms of the stress that they have. So I think there is something that is happening in terms of a change in society, in terms of change in the pressure that these young doctors have, and we need to really address that. There is a need to develop workforce, group discussions with young faculty and try and understand how we can de-stress them in terms of the challenges that they face. But I would say that even in an institute like AIIMS, where you see this huge crowd, and in a government hospital, there's a stress of not only doing your academic career, so being, working, preparing for your seminars, doing your thesis, and at the same time, spending the whole day in an OPD. Doctors would sit sometimes at 8:30 or 9 and get up only at 6 or 7 in the evening. And then you're expected to really be able to prepare for the seminar on the next day. So the workload has increased a lot without increased number of, let's say, the resident or doctors being available. And therefore, this is causing a huge stress. So we need to really see how we can decentralize things, decrease the pressure on residents and young doctors. And also, I think it's the responsibility of the senior doctors to try and see how they can help out. But it's a problem which is there. And I would say even before COVID, it was increasing. COVID really caused a huge surge, and we see this to a large extent. And this is actually causing a lot of mental health issues in young doctors.
Right. Talking of a particular specialty, Dr. Gupta, emergency medicine, what's been your experience like? Is the physician burnout more rampant in the specialty of emergency medicine? And how big is this problem and how real is it? Dr. Gupta?
Are you getting my voice?
We'll edit this out. You please go ahead. Yes, can hear you now.
So as Randeep sir has aptly said, regarding the concern which have been going over the past decade regarding this burnout, but COVID has definitely picked up this area. So in emergency medicine department, we work as a frontline workers. So the burnout cases, the burnout experience is very common among these people, especially the young brigade, because it's a new specialty who is growing over the years, and the young people facing the crowds, facing the emotional instability among the people and the teams, and working in a very tense environment. These all factors are increasing the burden, especially in the emergency medicine area. So there is a survey which has been carried out by the state of New York and Medscape report 2023, in which 9,000 physicians across the specialty joined this survey. And the survey showed that 65% of the burnouts are being seen in emergency medicine people, followed by internal medicine, pediatrics, and obstetrics and gynae. So basically, being a frontline, we have seen the emotional stability in the patients, the coming to the emergency, and the teens with high emotional instability, the violences, the verbal abuse that we face on daily basis. Even our best of days takes out a lot of energy from them. So we are more prone to the burnout as compared to the other specialties. But I would say that the front line and every physician working as that is facing the burnout very much. And with the growing medical practice, it is very common among us.
Right. Dr. Khetarpal, what about symptoms? Sorry, we'll edit this. Dr. Khetarpal, what about symptoms of physician burnout? What should we watch out for as a physician or as say the management team in that healthcare organization?
Yeah, see, firstly, burnout is not a medical condition or a disease. It is a syndrome which is associated with a specific health-related cause at the workplace. See, the cardinal symptoms for the burnout, there is, as Dr. Reddy also mentioned initially, there is energy depletion and total exhaustion of the emotional, there's emotional exhaustion. And depersonalization is also an important symptom, which means there is lack of empathy by the doctor or the physician, and there is negative attitude towards the patients, and pessimism, and also negative feeling again, and increased mental distance from one's job. So you are away from your job, you're not wholeheartedly involved in your job. And the third one is the feeling of decreased personal achievements or the personal accomplishment because of the reduced professional efficacy. So these are the main cardinal symptoms of burnout.
Right. Now, talking about the impact on the physicians, and we'll go on to the impact that physician burnout can have on patient outcomes. The next question to you, Dr. Gupta, what could be the potential consequences for unaddressed physician burnout for individual physicians and then, of course, the healthcare organizations that they serve at?
They feel tired all the time, mental exhaustion is there, inattentiveness is there, so they are irritable, their communication with the patient doesn't go well, they are more prone to the infections as well, and they are put on a prone. If we talk about they are driving towards the workplace or away from the workplace, they are more prone for accidents also in a burnout state. If we talk about the psychological point of view of a physician, so they are more prone to develop stress disorder, depressive illness, and there are increased odds of alcohol dependence and substance abuse has been seen in burnout individuals. So suicidal ideation, which is increasing, which we have seen over the decades, has been increasing in physician burnout as well. The frequency we talk about is more among the female physicians rather than male. And if we talk about the organization that is facing the challenges because of physician burnout, then there is more dropout. If you see, people are moving out of the specialty and they have to pull in more money to pull out the trained people and spend money in their training as well. And during that gap, it is giving a harsh time to settle down the workload that they have during time. And providing the quality care is an important aspect which hampers especially if we are talking about the frontline specialties.
Right. Moving on to the impact on patient outcomes. Professor Reddy, what could be the impact that physician burnout may have on the quality of care that patients may end up receiving?
Well, this can certainly be very detrimental to a physician performing the expected duties and thereby will adversely impact patient care. It does affect in terms of presence, participation, and performance of the caregiver. And therefore, the quality of healthcare definitely suffers, the quality of decision making suffers, and that will have adverse consequences. It also impacts teamwork. It's not just the person himself or herself who is going to be undergoing this kind of a burnout, but the lack of empathy and the lack of collaboration with other members of the healthcare team, and even the negative dynamics of interaction will definitely undermine the performance of the rest of the team as well. Therefore, you are likely to have that kind of a contagion of pessimism and distraction spreading across the team, and that will definitely detract from the performance of healthcare as intended. Then, even in terms of the patient morale, it suffers, because when there is lack of empathy and there is definitely not only perceived but real lack of attention coming from the caregiver, then the patient's own morale suffers, and that again adversely impacts the level of recovery and the speed of recovery from any illness. And even in terms of public health, if a physician who is involved in public health programs suffers burnout, then the program implementation suffers, and that has cascading influence effects on the community itself. And it also has an adverse effect on the family members. It's not just that the person himself or herself is retreating into himself, but the negativity will actually percolate into the family environment, and that can cause, again, damaging effects on both the psyche and the performance of other family members. And as has already been pointed out, unfortunately, the very high demands on women physicians, both professionally and also having to compensate at the same time with performance of family-related duties, makes them much more vulnerable. And so if they suffer a burnout, it has an effect on both levels, both at the professional level and at the personal level in terms of the family. So there are multiple areas where you have a serious problem. And of course, it can also spread into the other social networks in which the individual is participating. So that we are going to see waves of this negativity spread around, and that's going to be quite disastrous indeed in terms of its social impact.
Right. Thank you so much for describing the impact that physician burnout can have at different levels, not just at the individual physician level. The next question to you, Dr. Guleria, coming to COVID-19. You led AIIMS during COVID-19, which is the biggest public health emergency of the century. In your leadership role, did you see a spike in physician burnout during COVID-19? How big was that spike? And from the lens of the leadership role that you had, how did AIIMS look at addressing a thing while also looking at managing the public health emergency at hand?
So, right, COVID was a big challenge because not only was there a fear of the disease itself, but there was a lot of stigma attached as far as the viral infection was concerned. And that also affected healthcare workers. And then the strain of the increasing number of patients that came with the first, second, and the subsequent wave, third wave, caused a huge challenge as far as hospitals were concerned. And we had to actually then set up, with the help of the Department of Psychiatry, a whole section where we could have teleconsultations for our doctors in terms of the stress that they were facing, and even have group discussions among physicians so as to de-stress themselves and develop other strategies in terms of how they could really have a decrease in their work hours so that we could have more shift duties and give them some time off. But I think when we look at how you can address these issues, it looks at individual factors, trying to see how you can approach an individual and see what are the stresses that they have. There are, of course, family factors also. As individuals who have good family support tend to do much better as compared to those who don't. So students staying in hostels and staying all alone need that much more sort of support than those who have their family support in terms of being able to interact with them when they go back home. And then there's the organizational factor. The organization itself has to do strategies, and that is to have your, let's say, the psychologist available around the clock, not only in the hospital, but even in the hostel, and being able to be there as far as teleconsultations were concerned, because COVID, one was not able to physically come, but you could be just a phone call away, and that was something that was really developed. I think the other important thing was to have community participation, to get the community to make the doctors feel that they were doing something good and have a positive attitude, because that would also help in decreasing the burnout. So all of these actually helped. Although we did have a lot of stress, I would say that we were able to, a lot of doctors actually really did a lot and did not sort of shy away from the challenges that COVID actually put forward, and something that we're all proud of.
Absolutely. Dr. Khetarpal, would you like to add something more to it in terms of how can individual physicians, some of them who might be watching this webinar, how can they actively manage their well-being and address a thing as physician burnout?
Well, most important part is the prevention. So preventing burnout is most important, and physicians should adopt some certain strategies to prevent and manage burnout. The individual physician's wellness can be managed by reducing the work stress at the workplace and restoring energy at home. So these are the two major factors. and most importantly, adopting a healthy lifestyle. Physicians, they need to take care of themselves with respect to the diet, consumption of alcohol, smoking, regular physical activity, exercise, like indulging in sports, or maybe 30 to 40 minutes brisk walking, maybe most of days of the week, and yoga, meditation, and periodic breaks, taking periodic break from your routine work, and also taking care of your hobbies like maybe traveling, reading books, gardening. So there are various measures. And secondly, the self-care skills is very important, and the training for the self-care skills should start at the medical school level to create self-awareness and identification and prevention of burnout, and also the grief and bereavement management. And another important step is to have emotional regulation skills. Very important. You have to control your emotions, and also managing workloads with good planning. In the workplace, you should have flexibility in job, and avoiding substance abuse, and going for regular preventive health checkups, which most of the doctors are not. They are very careless about their own health. And this is not only the individually taking care of their health, but healthcare organizations also should modify some environmental factors that is contributing to burnout. And like workplace wellness program, they should have some workplace wellness program, and small measures like say having say compulsory coffee breaks in between. These small measures, they will definitely help. And most importantly and lastly, the social support. I think social and family interactions are very, very, very important. Because otherwise you are totally withdrawn. If you are withdrawn from the society, you are not interacting with the family, or you're not having an active social life, work-life balance. I think that will also, that you should take care of these aspects. So to prevent burnout, is advice.
Right.
Yeah.
So with that, we would also like to welcome Dr. Pratima Murthy to this panel. She's the professor and the head of department for psychiatry at NIMHANS. Dr. Murthy, just to give additional introduction, has made remarkable contributions in the field of mental health. She's played a pivotal role in establishing the state-of-art Center for Addiction Medicine at NIMHANS, and has her expertise been sought by esteemed international organizations such as the United Nations Office on Drug and Crime, the International Labour Organization, and the World Health Organization. So Dr. Murthy, you've joined us at the right time because talking about holistic management for physician burnout. Tell us something about some of the techniques, say mindfulness-based techniques or stress reduction practices that you recommend for physicians to enhance their well-being in a more holistic way.
Thank you, Dr. Ananya. The first thing I'd like to emphasize or underscore is that physicians are people first. So I think we also need to understand that we're human, that we undergo the same kind of emotions, the same kind of stresses. So in some ways we push, for various reasons, we push ourselves to the limit, which is fantastic, because I think that's where, we adopt very challenging roles. But it also means that very often we do that to the disadvantage in terms of exposing ourselves to a huge amount of stress, and consequently both psychological distress as well as physical distress. So I think being aware of what your limitations and your boundaries are is very critical, because I think work is like a sponge. You can continue to do, and there will always be more work, and people who are successful at work will also attract more work. And that's fantastic, to be motivated and to be excited about work. But I think we need to understand what our limitations are, or make sure that we work in a fashion that we are supported at work. That's very important. So I think that's something that Dr. Guleria referred to earlier, that working as teams is very critical, so that you don't feel isolated, you don't feel that, you don't feel guilty sometimes. Sometimes we overwork because we feel guilty that we are letting down our patients, etc. So Dr. Sunil made this point that if you don't look after your own health, you can't look after other people's health. And therefore, you shouldn't numb yourself and be insensitive, but at the same time, you should understand that you need to care for yourself. So some of the simple strategies are, and I think it's different things for different folks, different strokes for different folks. Some people, find meditation extremely helpful. Some people find yoga extremely helpful. Some others find Tai Chi very helpful. Some others, find walking their dog a very, relaxing kind of thing. So music is another very relaxing kind of thing. So I think it's about finding the right kind of way to calm yourself. The second thing is something that Dr. Khetarpal referred to, which is really about emotional regulation. Because, we go through a lot of different kinds of emotions, from helplessness, to anger, to a variety of things when the situation is out of control. So in some ways, learning to recognize what our finite limitations are and being able to take things in our stride without losing the sensitivity and compassion for patients. And that's easier said than done. I think that is something that physicians need to continuously do. And the third thing perhaps is to try. I'm saying try very specifically because I know the challenges in it, to maintain a work-life balance. And sometimes, work engulfs us completely. There's very little time for, even between that, even the few minutes that we might have, to find some space for yourself, to be able to calm down, maybe take a few deep breaths, to defocus on what's happening is also very important. The fourth thing is connectedness. The way we can actually dispel our stress is really to stay connected with friends, with families. I think WhatsApp and groups like that can potentially be a source of support. They can also be sources of stress, sometimes, because you really think. But I think finding those communities where you can get a lot of support. In fact, we've been so concerned, not just about psychological stress among physicians, but also premature death, as well as suicides, which are serious concerns for us. So we've started something called NAMA, which is really trying to provide support to physicians, to doctors, finally, hopefully to all medical graduates, as well as everybody in the healthcare profession, to see how is it that we can improve our self-care. Self-care includes looking after our physical health, as well as our psychological health. Spirituality for some people is one very good way of trying to, kind of calm themselves down and really stay connected. So whatever it is that works for people, to do that, to communicate their distress, because very often communication of distress is seen as a sign of weakness, but it's not really so. So I think we should not feel that we'll be stigmatized if we say that, just like you have a headache, you can have a bad day at work, you can feel anxious, you can feel depressed. These are emotions that one can express and get support for. So I think if I can just summarize what I've said, I think it's being able to take care of oneself, both from the physical as well as psychological point of view, having some things that help us to relax ourselves, of controlling our emotions in such a way that it doesn't cause a lot of stress, reaching out to people and finally recognizing our boundaries. I think these are some things that can help us to deal with stress.
Thank you, Dr. Murthy. Very, very important perspective on physician burnout. Since we are talking about strategies that have worked, coming back to you, Professor Reddy, what does the evidence say? What has worked globally or in India as far as addressing physician burnout is concerned?
Well, I think we need to address it at different levels, as has been already summarized very well. At the individual level, as well as at the organizational level, and the interface of the organization and the individual. I think it is absolutely important for us to give a clear message to the individuals concerned that they must set realistic goals for themselves and not be unrealistic in their ambitions, and therefore force themselves into a grind. And at the same time, to try and acquire the necessary skills and upgrade them progressively to meet new challenges with competence and confidence. Therefore, there is a learning element also as we move along, and that you get particularly not only through self-directed learning, but also through peers and superiors. So being part of that nurturing team is going to be very important. But even in terms of setting goals for oneself, it is important that one recognizes what stress does to the body. And it's not that stress is completely to be avoided, certainly not. Stress is like the musical string instrument. If the strings are too lax, you don't make good music. If the strings are too taut, you don't make good music. You just need the right amount of tension to make the music. So you have to determine what kind of tension and stress you need in order to enhance your performance, but at the same time not succumb either to a complete loss of confidence or to an exaggerated expectation that drains you very fast when you attempt to do the impossible. So I think that is at the individual level. Then at the team level, you need to foster good team dynamics, and that's very clear that wherever there have been good teams that have been set up and the teams nurture and support each other and cover for each other and ensure particularly that errors which are occurring because of physician burnout do not occur because there are others on the watch trying to prevent you from committing those mistakes even inadvertently, then that those kind of team dynamics really help you. But at the same time, you need a supportive organizational structure. You can't have very limited staff numbers. You can't have situations where there are drug stockouts, lack of equipment, all of which leads to frustration and often to anger of the patients and the families of the patients, which results in assault of the doctors as well. So the organization has to really step up its own performance in order to make sure that the work environment is fully supportive. At the same time, the relationship between the organization and the healthcare team also has to be very harmonious. We often find now, and I'm going out of my way here, now in a number of these private hospitals, for example, you find MBAs setting targets to the physician saying, we need you to do so many procedures for this week. Why haven't you done so many? Where is the revenue that you have brought in last week? Now, we must recognize that medicine is a profession, not a trade. You cannot push medicine down that alley. And therefore, even the way the organization is configured in terms of values is going to be very important in order to ensure that the physician does not feel pressure to do things he or she would not otherwise want to do as a duty-bound professional. So all of these are going to be important elements for us to tie together.
Thank you for this valuable insight, and so true for a lot of corporate hospitals as well. You spoke about the importance of a strong team support. Dr. Khetarpal, you're the director for the Association of Healthcare Providers. In your experience, what would you like to add as far as the role of peer support and collaboration amongst physicians is concerned, and such organizations or associations? Do you think they can contribute to addressing a problem such as physician burnout, and whether they can literally foster a sense of community?
Well, peer group collaboration among physicians can definitely contribute to reducing the burnout. Creating a wellness culture among the physicians is very important. So physicians should be, they should be interacting with each other, talking about the stress and something that's called eustress. It's a positive stress, or it's a good stress, we call it. So I think this also should be discussed. Sometimes this good stress or eustress is very important. It's required at your workplace to perform better. So I think we should not always be talking about the negative stress, but also eustress. And any clinical adverse event which is happening by any of the physician, it also creates a great impact on their work. And the organization should have the measures to mitigate the risk, mitigating the risk of emotional distress and burnout. And lastly, as Dr. Reddy also mentioned, that it's at the individual level and also at the institutional level, we need to have such thing. So at the individual level, we have already discussed, but at the institutional level, most important thing is that what changes we should make in the work environment, so that to make it more congenial, more convenient, more comfortable for the physicians. And of course, lastly, we should have a stress management program among the peer group. Stress management programs are many countries, they are actually having very active programs, I think. So we also should have, at the individual physicians level, group level, we should collaborate and have some stress management programs at the peer group level. So this will definitely help. Yes.
Right. Dr. Murthy, you did mention attempting to strike a work-life balance. So could you elaborate a little more? And I think that would hold probably true for a lot of other disciplines as well. I mean, going beyond medicine. So what's your advice?
Yeah, it reminds me of this particular officer who apparently once said, when I was younger, I loved to eat, but I just didn't have the money to eat it. As I grow older, I have lots of money, but I can't afford to eat. And I think this happens to us in all our careers. So, so striking balances becomes very, very important. And that's why I think it's very difficult to actually talk in general about all physicians, because a physician, let's say a physician in training, a junior resident or a senior resident, the way they also need a work-life balance, because sometimes they're working 24, 36 hours in a day and, have very little time for anything else. And of course, younger physicians who are starting off careers, maybe working in private practice, have a different kind of stress. People working in organizations at the lowest rank of the pecking order have a different kind of stress. People who are senior in organizations or, are seniors also have a different kind of stress. So similarly, I think just as we have different sources of problems that, control our levels of being able to deal or cope with it, I think coping and resilience become very important. So although this is about burnout and stress, on the other hand, how is it that we can cope effectively, stay motivated, stay energetic, and stay enthusiastic about the work? Because we are doing wonderful work, we are helping a huge number of people every day, we are saving lives. So I think it's about maintaining that enthusiasm. So I think staying motivated, creating some kind of something that kind of enthuses you every morning when you go to work. I think that's something that we all need to happen. Otherwise, life can be extremely monotonous. So reducing monotony in every which way we can. I used to find when I could that going for a 10-minute coffee break with my colleagues, having a few moments of laughter, very often at ourselves, was a wonderful way of actually reducing the stress and tension of the day's work. Similarly, I think while we are doing professionally, our families are passing, are also growing up. Our children are growing up. There are families, spouses, partners, aged parents. So we've got a lot of this to deal with. And that is why I think somewhere along the line, we need to have priorities clear. So this is something I kind of learned in the International Labour Organization, to kind of decide, your priorities. What is high priority and urgent to do? What is less priority but important to do? And what is low priority or doesn't need your attention? So try and delegate things to others if it doesn't need your attention immediately, so that you can focus on the tasks that you need to do at hand. Prioritize them. Sometimes when you have no control over what you're doing, that's a time of high stress. So try and break up an activity into problems, see which problems have solutions, see which is a reasonable solution for that. Try it out. If it doesn't work, try another one. And that's a very good way of maintaining work-life balance, both in your professional work sphere as well as in your personal work sphere. So these could be some simple techniques that one could use to maintain this. But at the same time, we need to make some time for the people we love. And we can do it in different ways, maybe by remembering important days and dates to reach out to people, spending a little bit of time, even if it's quality, if it's little time but quality time. telling people that, making them understand a little bit about the challenges we face. Very often we don't communicate the challenges we are going through to our families. And therefore families become extremely upset that, you're giving your entire time to your profession and none to family members. So I think creating that, it becomes important. If you want your family on your side, that's also very critical. If you want to work hard, your family has to support you.
Right. Thank you. Lovely. Talking of a systemic change, Dr. Guleria, you've led so many leadership positions. What do you think, what more could be done by India, by the government, to improve the larger bottleneck, which is the doctor to patient ratio? I mean, what are your thoughts, and how do you see physician burnout in that perspective?
India, we have a unique challenge that there is, of course, a sort of a skewed relationship in terms of the doctor and the patient load that is there. Multiple factors can be sort of brought into place. One, of course, is trying to see how we can decentralize and how we can really use other healthcare workers to be able to support doctors in the work that they're doing. It could be the nursing staff, which could be given more responsibility under supervision, so that a lot of work that are delegated to doctors themselves, whether it be in an OPD, whether it be in the emergency, or even in the ICU, can be given to trained nursing staff in terms of so-called nurse practitioners, and that could help in decreasing the load as far as doctors are concerned, because obviously if you expect the doctors will do everything, the load becomes too much, and there is a need to use the other healthcare workers, which could be the nursing staff, the health technicians, to help doctors as far as this is concerned. The other important issue is as far as data entry is concerned, because with EMR, electronic medical records coming in, it's expected that doctors will spend a large part of their time feeding in data, and that becomes something which also takes a lot of time. So one can develop strategies where you can have trained people who can support this as far as doctors are concerned, in terms of how one can look at feeding the data rather than doctors themselves having to do it, and a check mechanism can be in place. You can have now a lot of available tools as far as technology is concerned. But I think more importantly, as has already been mentioned, is to really try and see how we can address issues of the stress doctors face, both in the emergency, in internal medicine, in critical care, and try and address and see how we can improve the doctor-patient relationship and make doctors have a sort of better sense of that they're doing something good and feel more positive about the work that they're doing, and develop a better sort of life-work balance, which I think becomes more and more important. There's a huge stress that one expects doctors to keep working for days at end, but there is no break that they get, there's no entertainment, there's no support by the organization to look at how they can de-stress themselves. So developing a strategy which is sort of sustainable over a period of time in all organizations is something that needs to be done, with support from the government sector, various groups that can help doctors de-stress themselves and support them as far as the work is concerned.
Right. Thank you, Dr. Guleria. While you spoke about technology and filling out electronic medical records, that itself adding a lot of administrative burden, and also spoke about strategies to address it. But on the other side of the coin, Professor Reddy, do you think technology itself can play a role in reducing work burden in clinical settings, and could that be one of the solutions for reducing physician burnout?
Well, it can certainly help if imaginatively used. Particularly if you're going to be reducing the amount of patient referral to tertiary care centers by strengthening primary care with technology which enables care to be delivered at home or close to home, by non-physician healthcare providers who have